Hi, I'm Dr. Rahi, and I'm really excited because today I'm having Dr. MJ on the show. He is an international doctor who is from Brazil but trained in Spain and Venezuela, and he's here to talk about peptides. He is an anti-aging hormone and peptide specialist. This is going to be a really interesting episode because we're going to be talking about regenerative medicine and how we can use peptides to feel better. Give a big warm welcome to Dr. MJ.
Yay!
Hello everyone, I am here today with Dr. MJ. He's an international doctor trained in Spain but originally from Brazil.
Yes.
He's a specialist in anti-aging, hormones, and peptides. Thank you for coming.
Thank you for
I'm very excited to talk to you today specifically about peptides.
Awesome.
Great.
Here I am.
Peptides have been recently a popular subject amongst anyone interested in regenerative medicine. And Dr. Manuel happens to be an expert in peptides. So I'm really excited to talk about peptides because I know it will benefit my patients and also myself and anyone who's listening.
Of course.
So what got you into regenerative medicine?
Okay, about 12 years ago, I was doing a fellowship at the Barcelona with the physician of the Barcelona team, seeing professional soccer players, and we were doing a stem cells injections in the morning and seeing the same patient in the afternoon on the MRIs. So after seeing how regenerative these therapies are, checking an MRI 6 months before and after took my attention. Then when I come to the US and I found that there was the American Academy of Anti-Aging Medicine,
Right.
I started going to this academy to get certified.
And you're fellowship trained in the American Academy of Anti-Aging Medicine.
Correct.
So what that means is that you can provide all different types of anti-aging therapies for your patients.
Correct.
And when did you get into peptides?
I got into peptides right when I joined from the American Academy of Anti-Aging Medicine 9 years ago, I'm sorry. And I started studying and I got certified.
Okay, great.
Yeah.
What are peptides?
Okay, peptides are chains of amino acids that are they can be fragments of a protein, but the peptides are the ones that are signaling our body to produce a specific things. Like for example,
Right.
hormones, neurotransmitters, enzymes, with the goal to repair yourself, right?
Yeah.
Things that you've been losing with age can be rebuilt when you're doing peptides.
So we have all these peptides in our bodies?
Yes, when we're born, we usually have around 700,000 peptides, right?
How?
And the main reason we're probably not producing the same amount of peptides because we all have some type of inflammation that is not absorbing all these amino acids that we need to build these peptides, right?
Okay.
So when that happens is when we start declining our peptides. Like for example, the one that help us to grow hair, for the skin, for our joints, for growth hormone, for testosterone.
Amazing. So peptides can signal hormones and other processes in the body to help us regenerate and grow and retain our memory, be strong.
Correct. Yeah.
And how do you incorporate that into a patient's daily routine? If a patient comes to you in general, like let's say a male in his 40s and wants to feel better, how do you approach peptides for this patient?
Okay, the first thing that we have to do is always a blood test, right?
Mm-hmm.
See what are the results, and then see where the patient's goal. And based on that, you can say which peptide would be the best for that patient, right?
Right.
I always tell every physician that they should always start with a BPC 157, which has a broad of benefits, right? Because it helps you to heal your gut, which
Right.
is the main important one, right?
So you think everyone should be on BPC 157?
I think yes.
Is that because I know you can take that orally, but you can also inject it?
Yes, you can do both.
But you recommend oral for BPC 157?
So oral is very good if you have digestive symptoms, right?
Mhm.
But let's say that you have lesion in other part of your body.
Lesion as in, what do you mean by lesion?
I mean, let's say a tear on your joints or something.
Okay.
If you use BPC, it's going to help you to decrease the pain and heal faster. But also, it's very broad benefit because also increase growth hormone receptor. So if that person is producing growth hormone, it's also going to get the benefit of growth hormone. It's going to be producing more growth hormone receptors.
What would if a, in general, when you go see a traditional doctor, they don't talk to you about peptides or wellness. It's usually focused on, if you're sick, you go see a doctor and they help you get better. But this regenerative realm is more where people want to, feel better. So it's focused on wellness. So if someone has no background in medicine and really just wants to feel better and they want to see a regenerative doctor and consider peptides, what would be their steps? They'd come...
For a physician or a patient?
Both.
For both, okay, do a blood test,
yeah.
Right? Fill up a medical history of a functional medicine physician, which is a very complete medical history. Then do a physical exam, talk with the patient about what are their goals, and then create a treatment plan based on their needs.
But some people sometimes don't even know what their goals should be. For example, as we age, we change, and as soon as we kind of get into our 40s, we start feeling like the aches and pains, but a lot of people think that's just like a normal part of aging. So I guess my question is, how do you approach a patient when they think that everything is fine, but they do want to be a little bit stronger, better memory, or prevent certain diseases from happening in the future? If they feel fine in that moment, how do you convince them that peptides might be the route to reverse disease or reverse aging?
Yes, I ask them, do you want to feel normal or do you want to feel amazing, right? If you want to feel amazing, we have to optimize their levels.
Right.
How we can do that? With supplementation, with peptide, with the stem cells.
Mm-hmm.
That's how we optimize their health. Mm-hmm. And if let's say that they have less sex health, right? It's not like it used to be. It's gonna come back. If they have no memory as they used to be, it's gonna come back. So the patients are gonna see those results, and they're always gonna keep on peptides.
So there's peptides for chronic diseases, and then there's peptides for like acute things, like you were saying. BPC 157 helps with like acute pain, but it can also help with like chronic
with
issues.
Healings. Yeah, it's one of the best peptides really, because also remember when you decrease inflammation in your gut, you have the capacity to absorb those amino acids. So probably you're gonna be doing your peptides by your own again. They just have to bind with these peptides bonds, and they are the peptides.
Right, because you don't stay on the peptides continuously. You cycle through them.
Yes.
Like you do maybe 2 months of the BPC and then stop.
And then stop, and then you can try another peptide.
Okay.
Yeah.
But obviously this has to always be guided by a physician because
of course.
There's so many different peptides and it's hard to know which one to choose.
Yes.
But getting into that, there's a lot of controversy. Different states have different regulations on peptides. Do you know why that is specifically?
Well, really, I wouldn't like to talk much about that because there is something behind that I don't really know.
Yeah.
I don't know if it's political or it's the pharmas, but I really don't know.
Yeah, right. Are peptides as popular in other countries as they are, in America? Because I know they're growing here and a lot of patients are starting to use them, but I'd say maybe 10 years ago people weren't really using them.
Right.
What about other countries? Have you noticed other places that are as receptive?
Russia, Denmark, Ukraine, China, they're the biggest on peptides. Yes.
Oh, interesting.
Yeah.
What about in Brazil and Spain?
No, not that much.
More
in the US than over there, yes.
I like being able to have access to all like different types of medicine because I know in different countries you can't have access as easily to certain like regenerative medicines because I'm originally from Canada and I know in Canada it's more difficult to have access.
Oh, really?
Mm-hmm. Wow. What are some of the more popular peptides outside of BPC 157?
I would say, sermorelin is one of the first one. That is the one that stimulates human growth hormone. But also now we have CJC1295 with ipamorelin that also stimulates human growth hormone.
And what does that do for the patient? It helps with like muscle.
Oh well,
energy,
with muscle, fat burning, cognitive function, with the joints, everything.
Sounds like it does everything.
We have a hormone receptor almost everywhere in our body.
Sounds like everyone needs to be on that.
Yes.
What about reversing chronic diseases like diabetes or high blood pressures or?
Well, there are some sort of semaglutide is one of the one that people are taking with insulin resistant, and there's been showing very good results.
Is that considered a peptide still, or is it more like an like a GLP-1 agonist?
I think it's considered a peptide because it's on the peptide list.
Okay.
We better raise the bar.
Okay, we can edit. Okay, so now I got sidetracked.
Let's say that someone has insulin resistance.
Yes.
And if you treat this patient with semaglutide, and in the same moment you're treating this patient's food sensitivities, right?
Mm-hmm.
So you're decreasing inflammation. You target what is really causing that inflammation. What happens when you have insulin resistance, in most of the cases, it is activated because of inflammation, right? If you decrease inflammation and you also attack the high hemoglobin A1C, things can be back to normal.
High hemoglobin A1C means anything above 6.5 means you have diabetes.
Exactly. Yes.
Are you prescribing peptides more and more every day, you feel?
I'm prescribing peptides in Mexico, not here because I'm not a physician in the US. But of course, here I'm teaching physician. I'm working with physician, and I'm seeing how they do it, and there is no side effects. Patients are always happy because it's just signaling our body to produce things that we are probably not producing anymore because of age.
We need more peptides in our lives.
Yes.
Can you give some examples of maybe some interesting things that have happened with your patients when you started them on peptides?
Or I can tell you about my own experience.
Sure,
right?
that's perfect.
I started when I was 34 years old. So
I thought you were 29.
I'm 44.
It's the peptides.
Yeah.
It's the peptides.
So when I want to start a peptide, I always have to check three things, right? That are the most important ones, which are cortisol levels, your level of toxins.
And cortisol tells us like the level of stress in the body.
The level of stress in our body.
And toxins like environmental and pollution.
Exactly. And of course, a blood test, right? To see how is your hematocrit, especially. Because if you're gonna take a peptide that is gonna increase your human growth hormone, synergistically, it's also gonna increase your testosterone, which means it's gonna increase more red blood cells.
Right.
So if that happens, you have to tell the patient, donate blood, right? Then for the toxins, you have to take a good antioxidant, right? Which, for example, NAD, alpha lipoic acid, glutathione, right?
I love glutathione.
That is amazing.
It's amazing.
And also, if you want to decrease anxiety, you use C-Max and C-Lac. And why is this? Because if you have toxins, even if you give the patient an amazing peptide, it's not gonna work because the receptor is covered with toxins. And why the cortisol? Because it's the same. Always cortisol wins against any other hormones.
That's so true.
Yes.
When I used to work in the hospital, I used to work at nights, and my cortisol levels were all over the place, and I just could not regulate like my weight. And once I stopped doing that, and I got like better sleep, and I feel like my cortisol like evened out, and then everything just got better.
Correct. Yes.
So yeah, that's
Say
true.
that.
So you were gonna tell us what happened when you started yourself on peptides?
Exactly. So I start always with, let's say, NAD first time in the morning, right? Then I do a.
You just give yourself a shot?
I just give myself a shot, yes. Then I do a BPC 157. Then at night I use the C-Line nasal spray, and then I inject the peptide, the one that I want, or to increase human growth hormone, or can be kisspeptin if I'm low on testosterone, right? So then I try to have my levels optimals for the rest of the year. And how I make sure that those levels are gonna keep optimals? having a good diet, which means knowing which are my sensitivities, allergies and intolerance, sleeping well, and also eating well.
And what has that done for you?
Keeping seeing the benefit even after the treatment is done.
Mm-hmm. So you feel like it's kept your memory intact and energy and
yes. You don't have to be on peptide the whole year long. You just have to be on peptide. Let's say CAC 1295 is 3 months. You don't have to do it for the next 9 months, and then you can try another one.
And you do. I mean, obviously the dosing you have to get from your doctor, but in general, you don't do it every day of the week. You'll do it like 3 or 4 times a week, right?
You can do it 6 out of 7 days a week. The CAC 1295.
Okay.
For example, yes.
And you treat both male and female patients in this?
Yeah, we do male and female patients, yes.
And you find that both benefit?
Yeah, in both benefit, of course, you have to customize the dose for each of them, and easy.
What about trans patients? What about trans patients?
Trans patients?
Does it help in any way with their transition?
I really haven't treated any trans, but of course it can work.
For example, if you increase the testosterone in like
exactly
a female going to male,
probably you can just give peptide, right? And at the same time give them something to block estrogen production.
In general, are peptides used in that type of medicine, in the trans?
I really don't know.
Yeah.
But I think would be good.
It could help, right?
Yeah, I think it could help. Yes.
That's interesting.
Yeah.
And do you treat all age groups? Does it start from?
Mostly patient over 30.
Over 30.
Right? And one of the main reasons is if you check someone, for example, they check someone with the GHK peptide, right? The one that produces the copper peptide. They just add the copper to have a longer half-life. But the GHK is those 3 amino acids, the one that help you to build more collagen and hair, right? So they test a patient 20 years old and he had like 80,000 of GHK. And then they check another person who was 60 years old. That person has 90% less than the patient who was 20. So of course there is a decline.
Right. Yeah. And so do you treat patients like above 65?
Above 65 you can, yes, of course, yeah.
And for the copper GHK, do you put that topically in the hair? Or
it can be topically. You can also inject it on the scalp. There are some physicians in Mexico that are doing it, seeing amazing results with new follicles and new hair, and yes, the topical. And there is also a cream for the skin.
It helps like heal and stimulate more collagen, but also regenerates the hair.
Yeah.
So what would the difference between that and like PRP injections into the scalp?
Well, I think
would you do it together?
You can do both together, yeah, because you're at the end stimulating more growth factors, and yeah, you can do both together.
Cool. That's a lot of information on peptides.
Yes.
Thank you for sharing all this information.
Thank you.
What's your website so everyone can
My
find
website is www.uplushealthusa.com.
Awesome. So if I need peptides, I'll be calling you.
Of course.
Thank you. Thank you for coming and answering all of my questions.
Thank you.
I think it'll be very helpful.
Yes.
All right.
Thank you.
Thank you.